It's so Humans Healthcare started for healthcare executives, just as a way to help, I don't know, get information to them through storytelling. We're a part of this, Doug and I, Doug Morse and I are a part of this rural health, meeting now that started taking place on Fridays with a lady named Michelle Sexton.
Yeah, I just
She's,
had a call with Michelle for the
oh,
first
good.
time this week to meet her. Yes, yeah.
Cool. All right, good. So she's in the circle. And then, like she coordinates, a lot of other people who are, kind of mission driven by helping rural healthcare. And it's interesting to, get everybody on the phone and how we hear some of the same stories. But one of the things they tell about is healthcare executives, CEOs of small hospitals, actually probably any hospital, they're so reluctant to ask for help. And, it's really like hard for them, it sounds like, and I'm talking in generality, but there was a story that Michelle told about one CEO she was talking to, and he said that was, his experience out of 10 CEOs that he knew. If they needed help, 0 out of 10 would probably ask for it.
Yeah,
And so it was an interesting conversation. I didn't really realize that.
yeah, yeah. I had a similar conversation with a CEO not too long ago, and they're really struggling with some things in the patient experience. We have a lot of expertise and proven, ability to help organizations go from even, below average to top ranking #1 in the state in like 18 months. I mean, like it's just we got a
Nice.
pathway that gets you there and keeps you there. And you can reinvent the wheel, you can try, but or you can call an expert, right, to help you. And I was talking to him about that, and he says, we're going to give some things a go first, and try some things that we want to try to see if we can make some progress in it. And if it doesn't work, we'll give you a call. And I said, what if your boiler broke down, and you couldn't heat your building and your patients were cold? Would you go down to the boiler as the CEO and try to figure it out yourself before you called an expert?
Right. Good call.
And I just think you'd never do that to build a building or to fix your building. You'd call in an expert. But when it comes to especially operational things like, leadership development, program development, service improvement, quality improvement, I think they feel like they should know the answer.
Hmm.
And if they don't, maybe they shouldn't be in the job. And
Right.
so by asking for help, where if you ask a plumber to come in and do some plumbing work, you don't feel so bad because that's, not why they hired you. So you
Yep.
say, yeah, it's kind of normalized that I would call an expert. But when it's something in my world, I should know it already,
I
or
know.
I shouldn't be in the job.
Yeah, totally. And it's so funny because I think they're really willing to help others. I've found that to be true. They're, whenever I've asked for anything anyway, they've been, you know, eager to jump to, and then everybody I've introduced them to, they want to help them, but yet, here we are.
Yeah. Yeah.
Yeah.
Yeah.
Well, so you're Sue, and you have this amazing background. From what I can, what I've watched, you've spent 21 years at a hospital in Michigan,
Mhm.
and then you started a company, what, about 13
12
years
years,
ago?
almost 13. Yeah.
Wow.
Mhm.
And the company kind of originated because it sounds like you had some success at the end of your tenure at the hospital, and you had other hospitals that wanted to kind of emulate what you were doing. But it sounds like, from what I can understand, the board was like, well, we don't want to get too far away from our mission. And they really like allowed you and a friend to, somebody you worked with, to go off and do like a side hustle and help these hospitals after maybe the second one or third one came asking for help. Why do you think they did that? Were they feeling guilty? Did they really genuinely want to help, but just didn't want to mess up their situation?
Well, actually, what had happened was when we first, so it took us about 6 years, 3 years to like plan and 3 years to implement our own organization's turnaround and transformation. And on the heels of that, people started to notice. We got asked to speak at conferences, to share our learning and all of that. So people started like realizing that, we might know some answers to some questions that they have or problems they have. So we started to share those. And there was one hospital in particular that came to us and said, we need this same kind of thing to happen in our community hospital. And our board stayed very mission centric and said, no, that's not what we do. We don't help other hospitals get healthy. We help people get healthy. And so they said no, but in a year, that hospital that asked for help closed. And it
Wow.
was on the heels of that another hospital came to us and said, we need these same kind of, things fixed in our organization. Could you please share the answers with us? And again, our board wanted to say no, right? And they did. They said no, but they didn't want another hospital to close when maybe we did have some answers that could save that hospital. And so I think that's really what, I'm not even sure they were very serious when they said to Jane and I, maybe you could start a little gig on the side and go help this one hospital. I think they were kind of joking, but on the other hand, it was serious business, right?
Sure.
Because another community hospital closed when we said no. And we don't know how that story would have ended up if we would have said yes. And, I credit our board for being very mission focused and saying, if we take our eye off the ball and our mission and our work here, we might go backwards again, and we can't do that. We're the stewards of this mission. And so our mission is to help people get healthy. So I really thought it was the right decision by our board to not get into the business, which could have been a distraction or deterrent from the real mission.
Sure. Makes a lot of sense.
Yeah.
Yeah.
Yeah. So,
Yeah.
but then it turned into a full-time job, and
Yeah.
they lost Jane and I both. We left the
Yeah.
hospital, and and what I said, those 21 years I was in the hospital, I call it my insider years. And now I'm a B-sider, so I'm beside organizations,
Good
and
call.
it's a
Yeah.
different role. Um, as an insider, I was really helping one organization, but as a B-sider, I've been able to help dozens. And my original career goal was to be a hospital CEO. And again, I would have been helping one hospital at a time, right? And so I think I now see this as a bigger calling than being, an executive in one organization, that it really, I can impact dozens.
You
And
know
it's been
what? Like
a lot of fun work too.
that's actually very similar. Like I'm interviewing Quinn Studer in September, and his story's like very similar. He was really torn, it sounded like, between running the Pensacola hospital, but it felt like the calling, to
Mhm.
really spread himself over as many hospitals as possible. And then it just, it obviously it turned in for him to be, this amazing thing. And now he's, influencing so many people. But it sounds, like you have that in common with, I mean, I
Mhm.
revere him. I think he's been,
We do have
great
a
for
lot in
healthcare.
common. Our partners call us Studer on steroids, actually.
Ah, nice.
Mainly because,
Nice.
for small hospitals, because we really focus on healthcare organizations, less than 1,500 employees. Most of
Yeah.
them are between 300 and 600 employees. Most of them are independent critical access hospitals. That's kind of our niche. We're not looking to transform big, huge systems or big, huge tertiary care models. Although they do like some of our work, I know that there's some big systems that have huge affinity for our leadership model in particular.
Right.
And we're happy to share that. But our primary work, 90% of what our team does is in rural communities where we got to take two small, puddle jumper planes, get in a car and drive 3-4 hours to find them. But that's where we're working.
Yeah, yeah, no, that's for me, it's the same. Like there's a passion you have to have for that, right? And it's,
Yeah.
mine came out of Eastern Oklahoma, out of all places, and work a lot in Texas, but anywhere there's rural, there seems to be this commonality, this trait. And to me, it's just I'm drawn to it. I can't really explain why. And other organizations that I've worked with didn't quite understand that they were chasing dollars, I think. And it made it really hard for them to understand what I thought I needed to do to help somebody. And it had nothing to do with billing them. It had more to do with, I'll show up in any way you need me to. And you got to be kind of I think willing to do that. Sounds like you understand what you're getting into, obviously.
Yes,
Yeah.
yeah. And I think that it makes our work relatable to the
Mhm.
people we're bringing it to, because everything we bring forward, we've done ourselves in that type of setting. We're not trying to
Yeah.
translate it from something that just seems not, in
Yeah.
context with what they see and what they do every day. Um, so yeah, it makes it more relatable. Um, we're more trusted in that environment. We understand it. We know how the players wear multiple hats. We know the distractions that are different. And so, yeah, I think, this kind of work is difficult anyway,
Yeah.
but that deeper understanding and that, passion really makes it so that it's a bit easier, even though it's always going to be some hard work.
Right. No, that's fair. Right. And I
Yeah.
think I've heard you kind of talk about you have to have the energy yourself, right, to be able to expend. And it sounds like you teach that for every person to focus on themselves. Is that
Yeah.
accurate?
Yeah. So we have kind of in particular with leaders, we call it the 9 core leadership practices. One of it, which is promoting well-being, and that's not just for themselves, but also within their team and within their
Hmm.
employee and their workforce. And we again, we practice what we preach, and we eat our own cooking. And you really do have to, be your best self to be able to do your best work. And whether it's us doing the work beside these organizations or them doing it as leaders or employees or providers within it, part of being a great organization, a great team, a great employee or leader that gets great results is taking care of yourself. I mean, and
Hmm.
having the energy to do this work. And so, we have to eat well, sleep well, move well. We have to, work on our stress and all of those things. And even when we're on site with our organizations, these days are long and hard, and we're in front of people, and that
Yeah.
takes a lot of energy. I'm an introvert, so
Me too.
my business partner Jane, she's an audience feeds her and gives her energy. For me, it takes my energy, and I'm depleted at the end of the day. And so we have to know ourselves. But yeah, we really do emphasize. It's been part of our approach since day one. We didn't just add this in during the pandemic when it was kind of a top of mind with a lot of people just all of a sudden. It's been part of our work since day one, when we had to say, what did we really do in our organization to transform it? And how do we package it and deliver it to somebody else? What were the key things? That was one of the things that we were like, this was part of it. It actually came out of um, in Michigan, before it's now a regional patient safety organization, but in Michigan, out of the Hospital Association, the Keystone Initiative started, Quality Safety Initiative started uh, almost 20 years ago, probably now. I don't know the exact year, but I was an insider then. I was a chief nursing officer, and all the hospitals in the states, our very first project together as a statewide multi-hospital collaborative under the Keystone Center for Quality was really to decrease mortality and morbidity in critical care environments in hospitals in Michigan. It's well published. The research, it's out there of all of the impact of that work, saving lives, thousands of lives across our state. But one of the key things we did as an intervention to decrease mortality and morbidity in critical care was improve the well-being of the people caring for them.
Hmm.
And so, like, a major
Love that.
correlating factor was when we improved the well-being of our staff, less patients died. I mean, if that isn't impetus enough to focus on our employee well-being, right?
Yep.
So it's not just about service. It's not just about, burnout. It's just, there's so many things. But where the rubber met the road for me was patients lived
Yeah.
because our staff were well. And so, we just had to take that with us when
Sure.
we created our model. It's just so ingrained in us now. There's certain
Mhm.
things like that, they're not optional. We've got to focus on this.
Yeah, no, I think that it's certainly a core issue, right? I really appreciate the like having the evidence that because some people won't buy in unless there's data, right?
Yeah,
I
I'm
mean,
kind of one of those people too, though. I'm a
yeah,
data
right,
geek, and I
right.
like to, it's either our head or our heart or both that's going
Sure,
to compel us
sure.
to do these things. But data's for most people, some people,
Yeah,
me.
yeah. Right. No, exactly. And it's like some people can, go off of an energy or a feeling, I think, when they're determining where they want to, take something or a choice that's come up, they kind
Mhm.
of, but I think to back that up, something that I've always felt, is really important to be able to talk about that. It makes it easier. It makes it easier to have the conversation because not just my feeling, it's, it's got some good empirical evidence behind it.
Yeah,
Yeah.
absolutely,
Yeah.
absolutely.
Well,
Yeah,
great, great. I wonder in for you personally, how does all this sort of uh, drive you? Like when you think about where you're going for your future and you think about success for you, how does what you do sort of on a daily basis play into where you're going? And then what is the future for you? What are you excited about where you're going? And I mean, you've done a lot, right? So it's like
yeah,
how do you
yeah,
stay, like in the game and, always like excited about what you're doing?
yeah, yeah. You know, in the first phase of our company, it felt like it was R&D. It really felt like research and development. It felt
Gotcha.
like even though we knew that it worked for our organization, every time we brought this framework, this approach into another organization, it was still a dangling question mark. Will it work again? Is it like the scientific method of, is it
Sure.
repeatable? And so in the beginning, we didn't have that same level of confidence and certainty, and we needed to get that N up higher, you know, that evidence that this is repeatable. If you do X, Y, and Z, these results are on the other side of it. And so, you know, we weren't like going out finding, hundreds of healthcare organizations to do this with. There was, in the beginning, there was two of us, and then there
Hmm.
was three, and now there's 10, but
Oh,
there was just the two of us that knew this approach, and so we were the ones that had to bring it forward one at a time. And so it was a lot of research and development, and now that we've done it dozens of times, we're able to see patterns, and we're able to uncover the commonalities, and in particular the change barriers that are going to surface. So we used to think the magic was, what solutions did we put in the hands of the workforce, that if they got competent and consistent with these solutions, these standards, that, you know, the service and quality and safety would improve, and then you could grow easier, and then you could improve your finances, like this whole formula. And so we used to think the magic was in, what solutions did we offer up to employees and leaders in these organizations. But really, the magic we found over these 12 years of research and development basically is that the magic is in helping any individual or group of individuals. Actually, in our case, we work with entire organizations. So all employees, all leaders, what makes a whole group of people be willing to do it the new, better way, and to get consistent,
hmm.
confident with it, so we can realize those positive results. So it doesn't matter sometimes what the solution is. It could be the very best one, but if nobody uses it, or not enough people use it, you're not going to get the positive impact. So, really the R&D was an important part. And now that we know that it just keeps working, John Cotter, his work out of Harvard Business School, says that, basically, and others have said this, that when you research big transformational change, where it's, entire organization, not just one things, but multifaceted change, which is what we do. If that's happening, it should fail 70% of the time. Well, we can't have failure 70% of the time. In fact,
Wow.
if even one of our partners fail, it could tank our company, really,
Right.
because every single one is a possible reference for us and evidence of it working. So it has to work every time, and we have to craft a way to make it work every time. And so I think that R&D was important. But now that we've gotten it to this point, it's not cookie cutter, because it's not. There's a framework, there's very core methodology here, but it has to be customized. And I think that's where my nursing comes in, right? Is you have to assess very keenly and understand a diabetic is not a diabetic is not a diabetic, and a rural hospital is not a rural hospital is not a rural hospital.
Right.
So you still have to, right fit the solution, the prescription per se. But now it feels like, to your question about what's next, what gets me up and excited is now we're ready for the masses. Now it almost feels like a moral obligation. Like
Wow.
it's almost like if you found the cure to cancer and you just kept it for a small few,
Sure.
it would be, almost, I call that a sin. So it feels like that now. That's what gets me up is this just passion for taking what we know works and getting
Mhm.
it into more and more healthcare organizations. And in our world, that's small and rural hospitals. And I really firmly believe that when we strengthen a community hospital, we strengthen the community. They're often the largest employer. And when they raise the bar and they're growing and they're improving and their service and their quality is excellent, the whole community, every other business is like, dang, we better raise the bar in our business, like our
Sure.
restaurant, our hotel, and actually, we have people from the school system coming and saying, how can we learn from you? How can we incorporate this into to education and how we have a great workplace and how we serve our students better and deliver better quality education. So you really start to raise the bar for the community as well, and the economic impact. Like when my local hospital went from 324 employees to over 1,000, adding those extra jobs was a huge economic impact. I remember one time looking out at the parking lot, we had to like buy more property to add more parking
Right.
spaces. We had to build a 3-story parking deck
Wow.
to add more
Wow.
parking spaces for patients and employees. But I remember looking out an employee parking lot one day, seeing all of those cars. And I remember a time when there was not a very big employee parking
Sure.
lot. And I'm like, we're paying for the car payments and the insurance on those cars. I'm
Oh
betting
yeah.
through these jobs here. And that's helping our local car dealerships, right? And our
Wow. Yeah.
local insurance agents,
Yeah.
and then when 75% of our own employees wouldn't use their own hospital that they work for their own care for them and their family, and they were taking their insurance card 90 miles down the road, that was having an economic impact as well. But when they came back, right, and they started using their local hospital and the community started, then all of that revenue started turning over in our own economy instead of going over town, out of town. So that's what gets me up in the morning, really. Um, I
Beautiful.
love seeing a community hospital that was struggling,
Yeah.
and maybe their reputation and their results and out migration of patients and turnover of staff and all that. I love to see that turn
Yeah.
around. It
Yeah.
it takes years though. I mean, we
Sure.
used in my organization it took 6 years. We've got it down to about 26 months.
Wow.
Yeah.
Wow. Congrats. No, I mean,
Like,
there's so
that's a
many
blink of the
things.
eye, right? I mean, that's
Yeah.
really like my organization's more than 100 years old that I work for. You know, even 6 years was, a blip on the screen, but
Right.
maybe the most important blip on the screen in the
Right.
history of that organization.
Right. Yeah. No. And I like it fills my heart because I mean, I hear a lot of negative stories out there. Things happening that we don't want to happen. Hospitals in trouble, and if they only knew that there were, you and your
Yeah,
people out there. But another thing you said, like I'm an entrepreneur, so I've got, I get coaching. I take the
me
strategic
too.
coach, and so, and we talk about this as like the gap and the gain, and if you're always focused on the ideal and you're always striving for that, you never take the time to stop and look around like your parking lot, it's really hard to feel that, sort of like satisfaction. You're always chasing satisfaction. And so I love that story. I love the parking lot story that,
Yeah.
this was an indicator that you have success and like you should feel that. Otherwise,
Mhm.
what's the point? If you're always striving for something, you never reach it, what's the point?
Yeah, yeah. I do still love to set goals. So big, hairy, audacious goals.
Me too. Yep.
I'm a goal chaser for sure.
Yep.
But to your point is that, we also do have to recognize and look back and
Sure.
recognize, even if we're not there yet, what has the progress been, and you can't just celebrate when you get to the big goal. You have to celebrate all along the way. That's just part of getting there. I always like to equate it to being a hockey mom. My two sons played hockey, and it's like, you don't sit there quietly, in the stands and only clap when the game's over, right?
Right.
Every big hit you're cheering, every big save by your goalie, every
Sure.
great hit, you're cheering all along the way, and that keeps everybody moving towards the victory at the end. And so
Yeah.
yeah, it is good to watch what's happening and celebrate along the way, and
Yeah.
not just reserve celebration for zero defect or whatever it
Right.
is chasing.
Right. No, and I think that's what drives some of the storytelling, with this humans of healthcare thing is, when we hear good stories, it tends to lift us up, our spirits or whatever, our energy.
Yeah.
And there's a lot of good stories out there, and I've been in situations with rural hospital executives where they were reluctant to, talk about it because they didn't think that they were there yet. And they also, I mean, there's this weird thing that they think people are going to come out of the woodwork and they might pounce on them for taking credit because it
Yeah.
feels like they're always struggling. And so, but the confidence they need, I think it almost requires them to understand that there is good happening. It's not all bad.
Yeah, yeah. And sometimes the stories we have to tell aren't the pretty ones.
Right.
I know, like on LinkedIn, I see some of the people out there that are really in the quality and safety world, and they're sharing the stories of harm and the lessons from really sad, real true stories. And so some of the stories that I think that can be very motivating, or even some of the data sharing, being transparent and sharing of data, that can almost tell its own story, right?
Hmm.
I remember one time in my own organization, like, we had been tracking patient satisfaction for years, sending out those surveys, paying all that money, but nothing was getting done with the data.
Sure.
And so many, organizations, they might have quality data, finance data, patient satisfaction data, employee data, and they're just spending a lot of time and energy tracking it or
Hmm.
capturing it, but not really using it to do the two things data does. Helps us know what to work on and to know if what we're working on is working. That's all it does.
Right.
But
Right.
if you don't use it for that, then basically it's wasted time. But I remember one time we were sharing, we decided to share all of our trends of patient satisfaction data for the very first time. We had years worth of data, share
Sure.
it at a leadership meeting. This one leader, nurse leader, she walked right up there to the front of the room and she said, "I'm going to own fixing this." Like, I'm going to champion the cause that these survey results look way better than they do right now, and the way better than they have. And it was just painting the picture
Uh-huh.
of the voice of the patients through this data, that one person came forward and said, "I'm going to be the champion of fixing this."
This episode is brought to you by Downtime Trace.
In the world of medical imaging equipment, downtime is costly. Finding the right service options and determining if they are available shouldn't drain energy from medical professionals. Every day, healthcare workers face unique anxieties. It may seem small to some, but not knowing which local service experts are available, their qualifications if they're competent, when they are available is an unnecessary energy robber. With Downtime Trace, you can easily book local service technicians and get real-time notifications on your phone, similar to those you're accustomed to from mobile apps in your personal life. Once on site, service technicians capture a video of the problem they observe, diagnose the service needed, and provide a clear service plan with an estimated labor and parts costs and completion time. Familiar technology matched with decades of experience, track parts and service progress, and get the right updates when it makes the most sense. Once the service is completed, view comprehensive service data and rate their performance. Technicians gain greater autonomy by choosing independent jobs, while Downtime Trace ensures they receive payments within days compared to the many months that typical payment terms take. Downtime Trace ensures seamless communication, better and faster compensation for independent technicians, and complete transparency in service management. Download Downtime Trace now and take control of your medical equipment service.
I think you're right. I mean, there's a lot to getting people to adopt what they're reading and know how to work with the information.
Mhm.
And it's nice to know that you guys are there. What's the name of your company, just so people can,
Oh,
know
yeah.
how to find you?
Yep, it's Capstone Leadership Solutions.
Okay. Sounds like there's
And
10 of you now. I mean, that's
yeah,
crazy. That's a lot of growth in the past couple of years, it sounds like. Is that fair?
yeah,
Okay.
yeah. Jane, who was co-founder, she officially retired in June.
Oh, congrats.
So
Yeah.
yeah, so as of January last year, she stayed on as an employee, but I took over as the full-time owner, sole owner of the company last
Wow.
January. And we have a combination of employed staff, but then also independently contracted staff of healthcare executives that are still working full-time, primarily in our organizations that have used this approach. So, it's pretty specialized work, as you can imagine,
Oh,
that,
yeah.
it's our approach, it's a combination of things, it's our model. So, obviously, any of our staff would have to know our approach. And like I
Mhm.
mentioned earlier about that relatability, they have to have done it as well and speak to not just knowing what it is, and knowing how to teach others to do it, but being able to talk about the stories,
Right.
about how it's working, the results they're getting from it, the struggles they had maybe to adopt the new, better way, and how they made that work for them and why they're glad they did. So our independently contracted staff, Danny, they often, some of them actually, we have this thing with our partners that once they get through that heavy lifting of the first 26 months of work of getting this put into place in their organization, then it's about optimizing that forever. Our very first partner 12 years ago is still using this approach, and it's still, it's still
Nice.
alive and well, and that's what we want. But then they're like, well, we don't want it to be over. Like, like you're our partner. You're part of our team, basically. We would miss you if you went away. And we're like,
Right.
well, you know, how can we keep the relationship going with them where we could offer them support if they need more support? But what we did is we created what we call leadership exchange programs. So if one of their executives or leaders that knows our model and has been part of using our model, if they're willing to serve as a coach or a trainer to one of our, as part of our staff, if they're willing to do that, they might go on site to a client twice a year. Not like our coaches where it could be two or, once, twice, three times a month, but
Mhm.
just twice a year, maybe once in the first half of the year, once the second half of the year. They go on site and they help our clients with some on-site work, or they train at one of our leadership events or whatever. Then in exchange for that, we'll stay on to, support them and provide
Oh,
assistance.
wow.
So it truly is like a barter or an exchange of sorts.
Sure.
And so, and they find it to be, I know the very first CEO that I pitched this to was like our third partner. They started in 2013, and they had a chief nursing officer that was just, just so knowledgeable about all of this, very dynamic executive. And I said to him, I said, to the CEO, I said, can we borrow her a couple times a year? Like, could we like take her
Sure.
out of your building and put her in one of our hospitals in Minnesota once a year, or whatever, and do this work, take her to our 2-day leadership summit and stand in front of the group and train leaders on this? Like, could
Brilliant.
we steal her just a little bit?
Yeah.
And in exchange for that, we'll keep having you come to our group coaching calls. We'll still have, support of you and all that. And he's like, well, I'm really worried you might steal her. And I'm like, well, I could imagine. But then he said, if she was going to go anywhere
Yeah.
other than work for me, I would want her to work for Capstone.
Yeah,
He
fair.
said, so if I was going to lose her to anyone, I would rather it be that.
Yeah.
And so she did that for years before she did leave, and she didn't come to Capstone.
Okay.
But she did move on to a really great role where she's serving healthcare in a big way in Michigan. But he said to me, Sue, this is really a win-win-win. Like she wins, Capstone wins, my hospital wins, because every time she goes out, in training we learn, like in teaching we learn, in
Sure.
coaching we learn. And so whenever she'd go out somewhere, she'd harvest all sorts of things to bring back, not just give to that organization, but also give back to her organization. And
Yeah.
so we tried it once, it worked. And so we've replicated that. So right now I actually have 2 hospital CEOs that are on our team. They're still community hospital CEOs, but
Wow.
they believe in this so much that they work on our team in this leadership exchange capacity.
Yeah, I know people that would do that. I mean, seriously, like
Yeah.
you're saying it, I'm like, oh yeah. I mean, they'd barter all day if they could. It's just
Yeah.
there's not a lot of
Yeah.
people offering it.
Yeah. One of our CEOs, she even put it in her employment contract with the hospital that
Wow.
she was going to do this work. And as part of being the CEO, this was going to be something they also supported, was her serving in this role.
Nice. Brilliant,
That's
Sue.
how
That's
important it
fantastic.
was for her to keep
Yeah.
doing this work as a CEO.
Yeah, no, I mean, it's a good growth strategy, networking, and all that comes with that. It's really healthy for a business, it sounds like. Really
Yeah.
good for the hospital too. Like,
Especially when it's so specialized, right?
right.
If we brought somebody on with, maybe healthcare leadership experience, but not in our specific,
Yeah.
approach, there'd be a fair bit of learning curve, and we could do it, but that would slow us down. Like we just need to be, like I said, we just need to get it out there, and we have lots of people now, hundreds of leaders across rural healthcare organizations that have used this approach. So any one of them could teach it to others now. You only have to be about one step ahead of somebody else to be able to be their
Sure.
coach or
Good
trainer, right? We
call.
always think we have to be the expert
Right.
before we can hold ourselves out. We have to be so far ahead and the expert before we can hold ourselves out to being helpful to others as a trainer or a mentor or a coach. But you only really have to be, one
So
step
true.
ahead. And then
So
you bring them
true.
with you. And you get a step ahead and then you bring them with you.
Yeah, and I mean, you're learning as you're teaching. I mean, so you're actually going forward more quickly. You're accelerating, right?
Every
So,
time.
yeah, that's beautiful. I love that concept.
Mhm.
Really creative. It's funny how creative things come out of these, challenges that we face, right?
Necessity.
Yeah. Yeah, you guys are doing great. I'm glad to know you're out there. I just learned about you, oddly enough, a few months ago, and I'm like you. I'd love for people just to know that you're here and that you exist, and that they'd have an option. And I'm dealing with that a lot with my other business. It's like, how do we let people know what their options are? Because that could mean a lot to somebody just to
Yeah.
know. And it's hard. There's a lot of noise and everything. You got to break through all that. But yeah, I mean, from a growth strategy perspective, you start getting some momentum and some notoriety, it can really take off if in the right circumstances. It's hard to get there, right?
Yeah. Well, one part of our approach has actually kind of worked against us as
Oh no.
far as our reputation in the industry. In the beginning, like I said, we weren't going for masses. We were going for a high enough quantity of work to be able to do kind of the R&D and the development.
Mm,
And we've had now 3 iterations of how we work in partnership. We're always looking at ways to, tease out what's optional versus what's required. How can we do minimal dose, right? Like what's the
yeah.
minimal dose that's needed to get the results? And so, but geez, I forget where I was going with this. Oh,
About growth
about us,
and being, yeah,
yeah, us able to um, expand and really it being a moral obligation to do that
right.
is, we've got to build up our team to be able to do that.
Mm,
And so having people that are willing to do it as a second job
yeah.
is
Yeah.
going to be part of our solution. And
Yeah.
you just have to get creative in that regard. So
Sure.
now it's a different kind of company to
Mhm.
run. one that was thinking, okay, we'll just be a small, I was going to talk about, also like what's not worked in our favor with our approach is we don't let our partner organizations say they're a Capstone hospital.
Oh,
Nothing against Quinn Studer and Studer hospitals, but you hear that out there coined. I
oh,
know,
I got you. Okay.
where they
Yeah.
say, oh, we're a Studer hospital. Oh, we're a Studer hospital. And that's good for him. What great name recognition, right? That we're a Studer hospital, but we don't let our partners do that. In fact, we call it banned words to say you're a Capstone hospital,
Oh,
because we want them to create complete ownership for this work and this initiative. And we actually require them, as one of the first early steps, is to give this work or this initiative a name.
oh, wow.
And so, for instance, our very first partner that we worked with, they named their initiative the Cornerstone Initiative. And this is part of creating ownership, and that when we go away, it stays.
Right.
It's not like a project that you start and end. It is an initiative that is now creating this new way that we always improve and grow. And it has to have an internal name and, be
Sure.
branded as that if it's going to survive, right?
Wow.
The transition from
Yeah.
outside help to internal autonomy and independence.
Yeah.
So our partners don't, go out there and brag to people, we're a Capstone hospital, they say we have a Cornerstone initiative, and
Yeah.
these are the kind of things we're doing and the results we're getting. We were just their partners in getting it going and getting it organized and helping it, get its internal, foundational roots. So
Sure.
like our very first partner, 12 years later, we had our birthday in February of our company. We celebrated our birthday at their hospital. We went to their
Oh,
hospital
that's
and a birthday
cool.
party. And
Yeah.
when we were there, we also got to tour. They built a new hospital, and they built 2 new buildings on the campus of their new
My
hospital,
gosh.
because they've been growing so much. And one of their new buildings, they named the Cornerstone Building.
Oh, that's cool.
This is how much staying power, this has,
Sure.
and
Sticky.
yeah, it's sticky. So, and they even updated their mission and vision in the last couple years, and they added the word cornerstone actually into the vision of
Oh,
their
man.
organization. So
Wow.
when we talk about staying power, that's what we're
Yeah.
talking about. Ownership and staying
Yeah.
power is at 12 years later. They've had CEO turnover times 4. Their entire executive team is not the same one that started the Cornerstone
Wow.
initiative that we worked with, but it just keeps getting better, keeps
Sure.
growing. They keep using these systems that they put into place, and they mean so much to their organization that they name a building and they put it in their vision.
Wow, that is real. I mean, I'm really proud of that. That's an
Yeah.
interesting, like, I can't say this. I don't mean it to mean, I'm proud of you. That's a big deal.
I think so too. Like that
Yeah.
was the best birthday present I ever got,
Yeah.
was looking at the name of that on that building. Like I'm like,
Yeah.
wow. Yeah.
Yeah. That's
Yeah.
really impressive. And I think that's like one of the things with rural hospitals that you get is, you mean something to them, and you're
Yeah.
not going to get lost in the muck, so to speak. And
Yeah.
you can really have an impact out there.
Yeah. And
Yeah.
there's a lot of employees and leaders there that, they'll never remember meeting us,
Right.
that we were ever on site, that
Wow.
Capstone ever had anything to do with that.
Interesting.
That's actually what we want. And but
Yeah.
it works against us in some ways.
Yeah.
So
Yeah.
we've had to start these things that we call showcases now. So part of our growth strategy is to truly showcase the results that our
Sure.
partners have gotten. And so we try to about one a month, sometimes in person on site, sometimes virtually, more often virtually, because we're in rural areas and it's hard to do things like this on site and get, a lot of people to attend. But yeah, just really starting to tell their stories in both
Mm-hmm.
the number ways of where their numbers were when they started and where they are now.
Mm-hmm.
Have they doubled their revenue in 4 years with no price increases? Yay,
Wow.
let's celebrate
Yeah,
that,
that's
right?
huge.
Were they losing millions of dollars? Now they're making millions of dollars 4 years
Mm-hmm.
later. Yes, let's celebrate that, right? And
Yep.
let's showcase that. Tomorrow we're showcasing actually, we primarily work with small rural hospitals, but we've also tested our model in some niche areas or other areas like an addiction center in Detroit, also a nursing home, senior care
Ah,
system
good,
kind of
good.
sorts, for-profit clinic system in Minneapolis, for-profit surgery center owned by a whole bunch of ENT surgeons in Ohio. So we've tried it in some other areas, but tomorrow we're actually going to be highlighting a senior living. It's a group of different facilities of independent living, hospice, residential hospice, basics, nursing home care, dementia care. So they have these different homes. And they became a partner of ours and adopted our model. And their margins are so thin because 75% of their residents in their largest facility are getting, it paid for by a benefit that no one else will take because it pays so little that no other nursing home will take
Ah,
them, but they will take them. They're a safety net. 75% of their residents are paying this lowest rate that
wow.
anyone would, most won't even take. So their margin, they can't even pay benefits to their employees
Yeah. Wow.
because they don't have any margin. They can, and
Right.
they have to have every bed full to truly make any, to break even.
Sure.
So they had an 80% turnover rate when we started working with them.
Oh my gosh, I
I mean,
bet.
think about trying to retain employees in a
Yeah.
place that's that work and you can't even pay them benefits.
Yeah.
And then if you don't have staff, you can't fill all the beds because you
No.
don't have staff.
Yeah.
So they just reached, we've been working with them for just over 2 years, and they just reached 100% occupancy,
Wow.
and their turnover rate has gone down from 80 some percent down into the 20%.
Oh my gosh. That's
Yeah.
great.
And a
You
lot of
work
people that
there.
left have come back. And in fact, a lot of people that are left, some of them they're not letting come back because they're
Uh,
being very selective of who's coming
ah,
back.
yeah.
So so we're showcasing their story tomorrow on a virtual event, just to get the word out that a lot of people, they might not think that overcoming an 80% turnover rate in 2 years is possible
Right.
or
Right.
ever
Right.
possible.
Right.
But especially in the kind of work
That's
that
right.
this is,
Yep.
very hard work,
Yep.
very important work.
Uh-huh.
You got to have those people,
Yeah. No, I
or you
totally agree.
can't fulfill your mission.
No, I mean, I keep thinking this. If you can do it there, you can do it here. I mean, like you can do it anywhere, right?
True.
I mean, that's
Yeah.
brilliant. I
Well,
really
we really
appreciate
hope
that.
that their story will give hope to
Sure.
others, but
Sure.
let's circle back to one of your very early, comments earlier today, is that, people have to be willing to ask for help.
Yeah.
And fortunately, their executive director, she was willing to ask for help, and she was going to figure it out, because she ended up getting a grant
Uh-huh.
to be able to support some of our fees. We provided an in-kind donation as part of that grant. And
Nice.
so, yeah, she really had to get creative. We talked about that here
Sure.
today. The
Sure.
will, there's a
Yeah.
way.
Yeah, all
So,
the elements, right? I mean, humility and then grace and all that comes with that is, it's all so important. And I mean, any good leader, I mean, right, they're going to have these qualities and traits. And I've noticed that out in the rural hospitals, in my experience, there's a lot of them out there. It's just, some of them, don't get the opportunity to use those wonderful traits that they have, just under the surface.
yeah,
And, pride can get in the way sometimes for some, but really, I really think it's just good that we can reach them and get their attention. And that's what Humans of Healthcare kind of always was, is how can we get people's attention in a subtle way, to where it's entertaining enough to where they're going to watch. But if they were to watch, then maybe there's something there on the other side of that they're saying, oh, okay, maybe I should look into that,
yeah,
and they come to that idea through the storytelling, hopefully, right? And stuff like this. I mean, this is
yeah.
really intriguing stuff. If I've told good stories that have never gotten any traction, and I've told stories that were popular that have gotten a bunch of traction, and so it's just a weird dichotomy between what
Yep.
people
You
watch.
don't know
And
what's going to hit. Well, you don't know what's going to
no,
land. Just
No, and I think like I really went back to, the drawing board and said, look, there is a common trait. I've got a Gen Zer who's very talented working on thumbnails and, captions that get people's attention in an instant, the right demographics. I mean, you really have to do the work to figure that out, but she's got that comfort level, knowing what it takes to do that. And then you just, you edit the right way, you can do the stuff. It's
yeah,
just, I feel bad, like you, obligated to tell the story. But then, I look back at some of these great stories that didn't reach, and I'm like, wow, I'd
I
love to retell that with this, sort of new stuff that I know, because there's a
I
lot to be
know.
learned out there.
I hear you. I hear
Yeah.
you. Yeah, we never know either what's going to land, and when we first started our business, we were so into, like I say, research and development. So in our company, we have four pillars really that guides our strategy. One is serve, and that's really about get great results for our partners. And it's sell, which is get great new partners.
Mm-hmm.
And then it's develop, which is continually refine and develop our model.
Mm-hmm.
Always got to be, testing it and tracking its results and developing new, better, easier ways and resources and support. So that's always, and so in the beginning, we spent all of our time really on serve and develop. And self is our fourth pillar. So we talked
Oh,
about that
good,
earlier
good. Yeah,
too.
yeah, that's right.
So we have four pillars for our company, and so we have a strategic plan that spells out what we're going to do there. But in the beginning, we're so busy with serve and develop that we really didn't even stand up our sell pillar of
Ah,
our company. And it's like any company, if you're not getting new clients, if you're not getting new work, you have a hobby, you don't have a business.
mm-hmm.
And pretty soon, you can't even fund your mission and your work. So we've really, now that we've kind of, taken, it seems like a long time, right? Over a decade to really
Yeah, it
focus
does.
on the serve and the develop. Now we're just standing up our marketing and sales efforts. Like I
Uh-huh.
said, we kind of shot ourselves in the foot because we didn't make it easy for our partners to brag about us and
Uh-huh.
give
Sure.
us not all the credit we don't deserve. They've done the work, like
Mm-hmm.
we call it a partnership for a reason, but
Mm-hmm.
they've done the work. I feel like it's
Mm-hmm.
grandparenting. Like
Yeah. Okay.
I have children and I have grandchildren. Well, it's a different thing. When you're
Yeah.
an insider, you're a parent. When you're an B-sider, you're a grandparent. Like, so we're not on site every day.
Uh-huh.
They're on site every day. They're
Yeah.
they're shepherding this every day. They deserve, you know, the full credit. But
Yeah.
they could give us a nod from time to time
Right.
through these showcases and promote. But we need more than that. If we're
Sure.
really going to be a business, we need to stand up the marketing and sales. So we hired our first national account rep, and he has experience in sales in the medical arena. So we have our first salesperson
Oh,
on our
nice.
team.
Nice.
Actually, the
Wow.
first male on our team. He's
Oh
our
my
first
gosh.
salesperson and
Yeah.
our first male on the team.
Wow.
He fits right in. Like
Oh,
he just
good.
fits in our culture. It was really
Good.
interesting. I had like 80 applicants for the position.
Nice. Nice. I could see, I
Yeah.
mean, like, I came from a sales background, and I could see this being an attractive,
Mhm.
something we look for something we can believe in, right? If we're going to go try to push a product, right? It's
That's
got
what
to be
he
something
said.
I can buy
Mhm.
into, right?
Yeah. He's like, I can't do what the coaches do,
Uh-huh.
but I can make the same impact they do
Yeah.
by finding the next best healthcare organizations to make these transformations. Like he
Good for
goes, like,
him.
I'm the starting point, right? Like
Yeah.
they can't do any of their magic
Sure.
until. So he
Yeah.
really connects to, very obviously that's what we were looking for, is very
Yeah.
purpose driven, heart centered salesperson that really, is about the purpose of this, the
Yeah.
why.
Oh yeah, no, it's a great step. I actually Humans of Healthcare started a business, after about a year. We were kind of brought into the world of getting revenue, and it's through services. I didn't expect it to, I hear you never end up where you expect to when you start a business. And this is sort of what happened. And so now we're offering services to hospitals and then business owners, like, and so we're marketing, and it's like, okay, I didn't see that coming. But when you think about social media and people getting some exposure, through social media, like, it's kind of a foreign thing to a lot. And so the one thing that I find myself, and I don't know if I'm qualified to say this, but I find myself telling people is, when you've had a business for a long time and you're a technician and you've built it and you're an operator and you're technical and you're R&D and all these, it's hard to simplify your message to a point to where it can resonate with the general public. And for some people, it's almost offensive to say certain things, in a way. But it's like, if we could, when I talk to my clients, it's like, if we could just find something that's tasteful that you could buy into, but everybody could absorb. Like, for me, I got this product that I'm selling. It's like, it's Uber-like, but people could take exception to that, right? And they do sometimes, but the general public knows exactly clearly what I'm talking about when I say it, and they connect with it. And that's really the goal. So it's funny that at the end of the day, clarity about what you do and simplification is really the key, in my experience, to marketing on social media, because it's got to be fast,
Oh, yeah, for sure. For sure. And it does. Yeah. I totally resonate with your comment about, especially with the complexity of what we do.
Yep.
It's very hard to simplify. In fact, when Derek came on as our sales executive, a lot of what we've been doing since he came on board in October is we've been really working on our collateral and our messaging. If he's making a phone call, if he's giving a presentation, if he's sending an email, if he's, Whitney is the person in our office that does anything with the social media and what is done there. But, the two of them collaborating together with our team of coaches to really be able to articulate, what is it we do?
Right. Yeah.
It's not easy to say in a tagline.
No, I refine it every day. I have to be in the right mode too, because like, I built this thing and I'm sensitive just like everybody else. And I see like, wait a second, that doesn't at all do it. It actually is, again, it's offensive in some, but I find myself refining the message so often, and I think it's worth the time and effort at the end of the day if you get it right. But it's not stayed the same for very long. It always can be refined a little bit more, but it's just a simple message, and it takes so long to get there.
Well, in our sales paradigm, or our marketing and public relations, like, my paradigm is, as an insider in a healthcare organization, like, how you promote your healthcare services as a hospital is very different than how we promote ourselves as a business.
Absolutely.
So it's a completely different, and same thing with running the business. If I went in and ran became a CEO or an executive again in a $200 million healthcare organization, I know how to run a hospital. I know how to grow a hospital. I know how to improve a hospital. Like, day in, day out, give it to me. I'll make it happen, right? But run my own little business with 10 people.
I know. I hear you. I totally hear you.
My one little product, right? Like,
I know. It's unnerving sometimes. I mean, really, for me, it's been
the same. It does not translate.
Nope, it does not. But yet, I'm the entrepreneurship. I've kind of made some parallels to that in running a hospital too. Like, some mindset things, are similar. But you're right. When it's yours, it's just completely different. And I can relate. I can relate.
Although my husband said when I announced to him, honey, I think I'm going to leave my healthcare executive job and start my own business. Like, that was a nice conversation at home. He's always been supportive. He's a physician.
Nice.
But what he said to me was this. He goes, if you worked that hard for somebody else, I can't even imagine how hard you work for yourself.
That's exactly right. No, it's true. And it does translate, right? You can the effort is always there. Like, my investors are physicians, and like, they've been wonderful, by the way. Like, I don't know if that's a common trait, but I've seen a lot of physicians just like be super supportive, and and there's this perspective that they seem to have that I really love. And but yeah, it's been nice having them on my side.
Investors. We started.
Congratulations. Yeah. Bootstrapped.
This is all organic earn the money, put it back in the company, earn the money,
That's
put it back
awesome.
in the company.
That's awesome.
Funding our startup with our own
Yeah.
pensions and our
Yeah.
own cash, so yeah,
Yeah.
so it was, we've had it, we've had the risk of it all along.
Oh yeah, that's a big deal. It's a
Yeah,
big deal. Congrats. That's
yeah,
huge.
yeah, it is a big deal. Now, in hindsight, when I look and think, could we have hurt, so 2 or 3 times as many healthcare organizations if we'd have gone the investor route, maybe ramped up faster, bigger, all of that? I don't know.
Yeah.
I can't go backwards. I can't turn the clock backwards.
Right. Right.
We are where we are,
Yeah. Oh, for sure. You're in a great place. I
and
mean,
we're going
I
where we're
love the
going.
story. Yeah, the story's fantastic, and it's your story, right? What can you do?
It is our story.
You don't second guess. And you're successful. That's the other thing is you have your marks all over this thing. I'm
Yeah.
sure I'm sure that your coaches, sort of, they're like you a little bit, and I'm sure the policies have a lot of you in that. And that just takes
Mhm.
time. And when you have outside influence with money, sometimes it can really convolute that. And you got to be careful. You got to be really
That's a good
careful.
point. Yeah, yeah, for sure. We didn't get outside investors. We did have an outside advisory board for a couple
Uh-huh.
years where we put together our own, since we don't have a board, right? We put together
Sure.
our own advisory board. Only a couple of them were in healthcare. Most of them were just small business
Hmm.
brains
Yeah.
um, in the US and Canada. And so, yeah, for a couple of years, we had really close advisement with an advisory board helping us craft our business. So that was helpful
Interesting.
early
Oh,
on.
good. Oh, good. Yeah. Yeah. It's a business is a funny thing. It's got lots of different options and they carry you to different places. And sometimes, it's just all you can do to hold on and hope that you're doing the right thing. And, but I think it's really good. You look back, you give yourself credit for the good things and you have success. So whatever it took to get here, I mean, that's the most important thing.
Yep.
Yeah.
Yep.
Well, congratulations, Sue. Thank you for
Thank
doing this. I
you.
really appreciate it. We
You're
will
welcome.
edit this. I'm going to send it to you for final approval. Nothing will go out without you seeing it beforehand. It's really pretty simple. It might take
I
a
know,
few
I love
weeks.
that about my podcast too. I love to be able to edit the things,
Yeah.
because geez,
Yeah.
there's always
No,
something that needs to go. And
always something.
I could
I've
even
had
guess what they are right now that needs to go.
See, like I've had that. I've had people shut the whole thing down before and there's fear. I've done some CEOs where they're like, yeah, I'm just so trepidatious about this going out, and then I've had some that have kind of just did it, and then they really love the affirmation that they didn't expect, and so it's
Mhm.
just like I get the fear. But when you have control over the final edit, it's meant to
Yeah,
like help folks, kind of
yeah,
okay, I know it's going to go out. There's no gotchas, and these are pretty light. I mean, we don't really get
yeah.
into anything heavy, so
No,
it's
no.
positive stuff.
Yeah, yeah. I
Yeah.
do the same with my guests. I just let them know that if there was something that, if they name dropped something they didn't want to name, or
Yep.
they told a story, they're like, I really, in second
Yeah.
thought, I don't want that to be part of it. So,
Yeah. Yeah.
but
Yeah. It
yeah,
happens. It happens.
yeah.
Well, thank you again. We'll get it edited. I'll talk to you soon, and then I think maybe our
Maybe I'll see you
paths
on
will
one of the
cross.
Friday calls, that you guys
That'd be
have.
awesome. That would be so
Yeah,
cool. What a
yeah, that would,
great group of people.
yeah,
It
yeah. We were
it's
kind of introduced to that. Like I said, on Monday, we had a call and got introduced to that. And so we
awesome.
might be showing up on the Friday calls from time to
Oh,
time.
that'd be great. We start with a prayer and it lifts me up, and then we end with a prayer, and then it's just the people are so good to each other on that call,
Uh,
and they're so like considerate, and I do it a lot for that, frankly, just to get the camaraderie and because I'm isolated, and that's a
yeah,
great way to, not be so isolated in what I
it
do all the
does seem
time.
kind of lonely in this little entrepreneur
Yeah,
world,
it
especially when
does.
you're, a solopreneur or just have a small, well, remote office. Like all of our employees work
Yep.
remotely, but
Yeah.
yeah.
Yeah, me too. Me too. I'd love to see you there. And then, we're working on some things that, might include you, but I'm hopeful that I can talk to people that I know about what you do. And, eventually, like I have one in mind right now that might be a good fit for Capstone. So we'll see if we can
Yeah.
make some connections.
That'd be awesome.
Yeah,
That's like we said, we only have two main goals in our company: get great results for partners and get great new partners.
that's
So,
that's what's going to matter to these people. I mean, they need help, and they come to me, and I feel inadequate sometimes. I'm a connector, but now that I have another connection, it's going to be nice.
yeah,
I can say, hey,
I love
here's
being connected too, because
yeah,
sometimes, folks don't want the breadth of help and the, big solution that we offer, and they want, or they need something that we don't offer. So I do like making connections as well and being
cool.
helpful in that way. So,
Awesome. Awesome. Well, cool. Well, I hope to talk again soon, and we'll
yeah.
talk either way. I'll get you this and we'll go from there.
All right. Well, you have a
Okay.
great rest of your week, Danny. Thanks for inviting me to
Yeah. Thank you,
participate.
Sue.
I
It's
very much appreciate
been
it.
a pleasure.
Bye now.